Androgens are a class of steroid hormones that act as agonists to androgen receptors. Testosterone is the principal endogenous androgen, while synthetic androgens include testosterone derivatives and anabolic steroids. They bind to and activate androgen receptors and are used in the treatment of conditions where testosterone levels in the body drop lower than normal, such as primary or secondary hypogonadism. Now, anti-androgens or androgen antagonists include androgen receptor inhibitors, 5-alpha reductase inhibitors, and inhibitors of testosterone synthesis. They prevent the biological effects of androgens like testosterone in the body and are used in the treatment of prostate cancer, benign prostatic hyperplasia, hair loss in males, and hirsutism in females. Testosterone, the primary male hormone, is an androgen, andro meaning male, and gen meaning to produce, which means testosterone helps generate the characteristics associated with male sexuality. The effects of testosterone are first seen in the fetus, where it guides development of the male urogenital tract and external genitalia, as well as testicular descent through the inguinal canal. Testosterone is primarily secreted by the fetal testicles. The fetal ovaries also secrete testosterone, but at much lower levels, and this largely explains the differences in fetal development between boys and girls. In puberty, the hypothalamic pituitary axis regulates testosterone levels and gonadal function. The hypothalamus secretes gonadotropin-releasing hormone, which causes the pituitary gland to secrete luteinizing hormone, or LH, and follicle-stimulating hormone, or FSH. These hormones travel to the testes and cause Leydig cells to convert cholesterol into testosterone through a number of steps. Two important intermediate molecules in that process are dehydroepiandrosterone, also called DHEA, and the molecule that it gets converted into, androstenedione. The last step is to have the testicular enzyme 17-beta-hydroxysteroid dehydrogenase convert androstenedione into testosterone. Alright, now testosterone is responsible for primary sexual development, which are the changes necessary for reproduction, like enlargement of the penis and testes, as well as increasing libido. Testosterone also helps with secondary sexual characteristics which aren't required for reproduction but are associated with masculinity, like a male pattern of hair growth on the face, chest, axillary, and genital areas. The hair itself changes from thin, soft hair of childhood to thick and coarse hair of adulthood, and the voice eventually deepens. Testosterone also has tissue-building effects, sometimes called anabolic effects. It contributes to the growth spurt in puberty by making the bones longer, while it is also responsible for the closure of the epiphyseal plate in late puberty. Other anabolic effects include development of broad shoulders and muscular arms and legs. Last but not least, testosterone stimulates erythropoiesis, giving men a higher red blood cell count than women. In some tissues like the prostate gland and hair follicles, the enzyme 5-alpha reductase converts testosterone into dihydrotestosterone, or DHT, which is like a more potent version of testosterone. Now, in some pathological conditions, testosterone levels in the body drop lower than normal, which can lead to a variety of problems ranging from delayed puberty in children to decreased libido in adults. Low testosterone levels can also suspend normal growth and affect secondary sexual characteristics during puberty, while it may cause anemia and decreased muscle mass in adults, ultimately leading to limited physical ability. On the other hand, too much androgen, especially testosterone, play an important role in both benign and malignant prostate diseases, hair loss, and hirsutism. Okay, androgens as a class of medication are steroid hormones. Testosterone itself can be given by subcutaneous implantation, by a transdermal patch, or via buccal administration. Synthetic androgens are agonists that activate androgen receptors on the cell surface, just like endogenous testosterone. There are two types of synthetic androgens, the testosterone derivatives and the anabolic steroids. Testosterone derivatives include fluoxymesterone and methyltestosterone, which are given orally, and testosterone esters like testosterone cypionate, which are long-acting androgens given by intramuscular depot injection. Now, testosterone and testosterone derivatives are mainly used for testosterone replacement therapy in hypogonadism in biological males, where low levels of testosterone in the body result in delayed puberty or delayed sexual maturation. They are used both in primary hypogonadism, meaning testicular disease, and in secondary hypogonadism or hypopituitarism, meaning pituitary disease, in order to stimulate the development of secondary sexual characteristics and accelerate growth. They are also used in order to stimulate anabolism as a means of promoting recovery after a burn or injury, and in order to promote weight gain in patients with wasting syndromes like those with cancer or AIDS. Now, both testosterone and testosterone derivatives can cause masculinization in females, which includes enlargement of the clitoris, acne, and hirsutism, which is the growth of facial and chest hair, as well as menstrual irregularity. In males, excessive doses inhibit LH release via a negative feedback mechanism, which leads to a decrease in intratesticular testosterone and gonadal atrophy. This inhibition of the pituitary can cause paradoxical feminization, including gynecomastia and infertility. Other side effects include premature closure of epiphyseal plates, which impairs growth in children. Finally, they cause an increase of low-density lipoprotein, or LDL, and a decrease of high-density lipoprotein, or HDL, which leads to obesity. Alright, moving on to anabolic steroids now, which are androgens that have been modified chemically to increase their anabolic action. They include medications like nandrolone and oxandrolone. They tend to increase muscle size and strength and promote erythropoiesis, meaning they increase red blood cell production. However, their clinical use is limited. Anabolic steroids are used only in the treatment of aplastic anemia, a condition where your bone marrow stops producing enough new blood cells. They have also been abused illegally by athletes to increase athletic performance. Now, side effects are similar to those caused by testosterone derivatives. However, high doses of anabolic steroids can also cause cholestatic jaundice, a reduction in bile flow from the liver into the small intestine that eventually leads to bile salts depositing in the skin, giving it a yellowish color, increasing liver enzyme levels, and hepatocellular carcinoma, which is a liver tumor. Last but not least, high doses of anabolic steroids increase the risk of coronary heart disease. Okay, switching gears and moving on to anti-androgens, which include androgen receptor inhibitors, 5-alpha reductase inhibitors, and inhibitors of testosterone synthesis. Let's start with androgen receptor inhibitors, which include flutamide and spironolactone. Flutamide is a non-steroidal competitive antagonist of androgen receptors that inhibits the translocation of steroid receptors to the nucleus. It's used in the treatment of prostate cancer in order to decrease the action of endogenous androgens, since prostate cancer cells depend heavily on androgens for survival early in the course of the disease. Now, flutamide can cause gynecomastia or breast enlargement, hot flashes, breast tenderness, and sexual dysfunction including reduced libido and erectile dysfunction, as well as gastrointestinal disturbances like diarrhea, nausea, and vomiting. Spironolactone, a drug used mainly as a diuretic, acts also as a steroidal antagonist to androgen receptors. Due to its anti-androgenic effects, it is used in the treatment of hirsutism and in polycystic ovary syndrome, or PCOS, a condition with marked symptoms related to excess androgen production. It can also be used in men to reduce androgenic symptoms like male pattern baldness, meaning a thinning of the hair starting from the crown of the head. Alright, now side effects of spironolactone include gynecomastia and amenorrhea, which is the absence of ovulation and menses. Moving on to 5-alpha reductase inhibitors, which, as their name implies, inhibit the enzyme 5-alpha reductase, which is the enzyme responsible for the conversion of testosterone into dihydrotestosterone, or DHT. Some tissues, mainly the prostate gland and hair follicles, depend on DHT rather than testosterone for androgenic stimulation. 5-alpha reductase inhibitors primarily include finasteride. Now, finasteride is used to treat benign prostatic hyperplasia, or BPH, which is the non-cancerous growth of the prostate gland, and in lower doses to prevent hair loss in men. Now, finasteride can cause gynecomastia, infertility, and sexual dysfunction, but less frequently than the other anti-androgens because it does not interfere with the action of testosterone. Now let's make a simple and fun mnemonic that'll help you efficiently memorize these pharmacology facts. So let's go to the gym. The androgens are all training by the equipment, while the anti-androgens are chilling on the sofa. In the androgen section, we have the testosterone derivatives that often end in sterone, like fluoxymesterone and methyltestosterone. So let's have a hunky man lifting a large stone. For indications, testosterone derivatives are often used to treat hypogonadism in biological males. So let's put a hummingbird nest with 2 tiny eggs to represent this. Since it could also be used to promote healing and weight gain, let's have the dad hummingbird wrapped in bandages, and it's also carrying a dumbbell. For side effects, let's look to the mother hummingbird. She's crying over some eggs that fell from the nest. The shattered egg represents gonadal atrophy, and one of the eggs has a tiny bird skeleton inside to help you remember the premature closure of epiphyseal plates in the bones. The mother bird herself has a very manly mustache to help you remember these drugs cause masculinization in females. Next up, we have anabolic steroids, and since they usually end in drolone, like nandrolone and oxandrolone, we'll have a drooling guy who's very lonely. He's training by lifting 2 plastic bags full of red blood cells to help you remember their medical indication is aplastic anemia. Let's have him stand by the mother hummingbird since the side effects are similar. These drugs also have some additional side effects, so by his feet there's a crab lifting up a liver to help you remember these drugs increase the risk of hepatocellular carcinoma. Globs of bile are dripping down the liver, which represents cholestatic jaundice. For increased risk of coronary heart disease, the drooling man is terrified of crabs, and he gets a heart attack, so he's grasping his chest. Okay, let's head to the sofa where the anti-androgens are hanging out. Here we have a big snail with a spiral shell for spironolactone, and on its back there's a maid playing a flute for flutamide. Flutamide is used to treat prostate cancer. We'll have the maid balance a walnut on her head since the prostate is about the same size and shape. The walnut is cracked and a crab claw is sticking out to help you remember it's cancerous. Spironolactone can treat symptoms of virilization, like hirsutism, so let's give the snail a big bushy mustache. In men, it can treat male pattern baldness, so let's give him a large mohawk to represent hair growth. Okay, on to the 5-alpha reductase inhibitors. In front of the sofa we have an asteroid for finasteride that's being used as a coffee table. Its main indication is benign prostatic hyperplasia, so let's put a much bigger walnut on top of it. And a minor indication is male pattern baldness, so let's give the big walnut a mohawk too. Okay, so the anti-androgen side effects include gynecomastia, so let's throw a bra by the sofa, and sexual dysfunction, which will be represented by a pair of boxers with little hearts on them. Alright, as a quick recap, androgens include testosterone, testosterone derivatives, and anabolic steroids. They all act as agonists to androgen receptors. Testosterone and testosterone derivatives are used in the treatment of hypogonadism, to promote recovery after a burn or injury, and to boost weight gain in patients with wasting syndromes like in cancer or AIDS. Their side effects include masculinization in females, gonadal atrophy, gynecomastia, and infertility. Anabolic steroids are used only in the treatment of aplastic anemia, while they have also been abused illegally by athletes to boost their athletic performance. Their side effects are similar to those caused by testosterone and testosterone derivatives, but they can also cause cholestatic jaundice, liver cancer, and coronary heart disease. Androgen antagonists include androgen receptor inhibitors and 5-alpha reductase inhibitors. Flutamide, an androgen receptor inhibitor, is used in the treatment of prostate cancer. Spironolactone is used in the treatment of hirsutism and acne due to PCOS in women. Finasteride, a 5-alpha reductase inhibitor, is used to treat benign prostatic hyperplasia and to prevent hair loss in men. Side effects for antiandrogens include gynecomastia and sexual dysfunction. But wait, there's more! Here's a mind map with all of the mnemonics. Go ahead and pause the video so you can test yourself to see what you remember. Stay tuned for the answers after the credits. Synthetic estrogens are a class of medications that act like natural estrogens and are mainly used for primary hypogonadism, primary amenorrhea, estrogen deficiency, and as contraceptives. Now, anti-estrogens, or estrogen antagonists, include full antagonists, which antagonize natural estrogens in all tissues, and selective estrogen receptor modulators, or SERMs, which act as estrogen antagonists in some tissues, but also act as estrogen agonists in others. Full antagonists and SERMs are used for breast cancer, and SERMs are also used for osteoporosis. But first, let's talk a bit about natural estrogen, which plays a big role in the menstrual cycle. The hypothalamus, which is part of the brain, secretes gonadotropin-releasing hormone, or GnRH, which travels to the nearby pituitary gland and stimulates it to secrete two hormones: follicle-stimulating hormone, or FSH, and luteinizing hormone, or LH. FSH and LH make the ovarian follicles, which are scattered throughout the ovaries, develop and secrete the female sex hormones, estrogen and progesterone. These hormones gradually increase during the first 2 weeks of the cycle, called the follicular phase. But estrogen is the main hormone synthesized during this phase. The high estrogen levels stimulate the thickening of the endometrium, the growth of the endometrial glands, and the emergence of spiral arteries from the basal layer. The high estrogen levels also make the pituitary more sensitive to the actions of hypothalamic GnRH, acting as a positive feedback signal. And at the end of the follicular phase, it leads to a massive surge of FSH and LH that leads to ovulation, where one of the follicles releases an ovocyte. Okay, now the 2 weeks following ovulation is called the luteal phase, where the follicle that released the oocyte becomes the corpus luteum. This structure mainly synthesizes progesterone, which helps maintain the uterine lining so a fertilized oocyte can implant. Other than the menstrual cycle, estrogen, along with progesterone, are also responsible for the maturation of the female reproductive organs during fetal development. These hormones trigger the growth of the fallopian tubes, uterus, cervix, and vagina. Estrogens are also responsible for the development of female secondary sex characteristics during puberty, like the growth of breasts, widening of the hips, as well as distribution of fat on the buttocks, hips, and thighs. Alright, now estrogens also act on a systemic level. They have a protective effect on the cardiovascular system by keeping the blood vessels' walls flexible and by lowering the levels of LDL cholesterol. In the skeleton, estrogens decrease the action of osteoclasts, which break down bone, and increase the action of osteoblasts, which build up bone. So they help sustain bone density. The bad news is that during menopause, which usually happens around age 50, the ovaries run out of functional ovarian follicles. That leads to a decrease in estrogen levels, accounting for many of the symptoms preceding menopause, like hot flashes, night sweats, vaginal atrophy, and bone fractures due to osteoporosis. However, a small amount of estrogen is still being synthesized by the adrenal glands and the fat cells in the woman's body. Synthetic estrogens are estrogen receptor agonists and include ethinyl estradiol, diethylstilbestrol, or DES, and mestranol. They can be given orally, via transdermal patches, vaginal creams, or intramuscular injection. Okay, now synthetic estrogens have various indications. First, they are used for primary hypogonadism, or primary gonadal dysfunction, in which low gonadal activity leads to low levels of estrogen in the body, resulting in delayed puberty or delayed sexual maturation. So synthetic estrogens can stimulate the development of secondary sexual characteristics and accelerate growth. Now, when estrogens are given in girls with hypogonadism, if the dose is not adjusted carefully, they can cause premature closure of the epiphyses of the long bones, resulting in short stature. They are also indicated for primary amenorrhea, where menses fails to occur by the age of 16 in the presence of normal growth and secondary sexual characteristics. In this case, synthetic estrogens can be given cyclically to mimic the natural menstrual cycle and trigger menses. Alright, now after menopause, estrogens are also indicated to replace the loss of estrogens and relieve menopausal symptoms, which is referred to as hormone replacement therapy, or HRT. Another indication is estrogen deficiency, resulting from surgical removal of the ovaries or from premature ovarian failure, where the ovaries stop ovulating and producing hormones before the age of 40. Estrogens are also indicated as hormonal contraceptives along with a progestogen. Alright, now let's move on to side effects, which include vaginal bleeding, nausea, and breast tenderness. They also increase the risk of thromboembolic events, like deep vein thrombosis in postmenopausal women. There is also an increased risk for endometrial cancer when given without progesterone to counteract their effects on the endometrium, as well as a small increase in the risk for breast cancer. Finally, a super important side effect of diethylstilbestrol is that females that were exposed to DES in utero, meaning that they are daughters of women who were treated with DES during pregnancy, can develop vaginal adenosis and clear cell adenocarcinoma, which is a type of vaginal cancer. Okay, next we have anti-estrogens. Let's start by looking at the selective estrogen receptor modulators, or SERMs, which include tamoxifen, raloxifene, and clomiphene. Remember, SERMs have estrogen agonist effects in some tissues, but act as estrogen antagonists in others. Okay, but let's be more specific. Tamoxifen acts as an estrogen antagonist in breast tissue, and so it can be used to prevent and treat estrogen receptor or ER-positive breast cancer. On the other hand, tamoxifen acts as a partial estrogen agonist in bones, and thus it can be used to prevent osteoporosis in postmenopausal women. Moving on to side effects, tamoxifen also acts as an agonist in the endometrium, which can result in the formation of polyps, endometrial hyperplasia, and increase the risk of endometrial cancer. Other side effects include thromboembolic events and hot flashes. Alright, now let's move on to raloxifene, which, like tamoxifen, acts as an estrogen antagonist in breast tissue and as a partial agonist in bones. Raloxifene is the medication of choice to prevent and treat osteoporosis in postmenopausal women. The good news is that raloxifene, unlike tamoxifen, has no estrogenic effect on the endometrium, and so it does not increase the risk of endometrial cancer. Side effects include hot flashes and an increased risk of thromboembolic events. Okay, next we have clomiphene, which acts as an estrogen antagonist in the hypothalamus, preventing the normal negative feedback, and thus increases FSH and LH output from the pituitary and ultimately stimulates ovulation. It is used to induce ovulation and treat infertility in women who wish to become pregnant but have anovulatory cycles. Moving on to side effects, clomiphene may cause hot flashes, ovarian enlargement, multiple pregnancies due to multiple ovulation, and visual disturbances. Okay, finally let's move on to full estrogen receptor antagonists like fulvestrant. Unlike SERMs, full antagonists have anti-estrogenic effects in all tissues. Fulvestrant is used for breast cancer that is resistant to tamoxifen. Now let's make a simple and fun mnemonic that'll help you efficiently memorize these pharmacology facts. So first, let's go to an office where there's a big pile of paper with the letter E on them. And this is where we'll put the estrogen receptor agonists, or synthetic estrogens. On the other side of the room, there's a paper shredder which represents estrogen receptor full antagonists. Between the paper and the shredder, we have a recycling bin where we'll put the SERMs that act as both agonist and antagonist. For the indications of synthetic estrogens, let's put an office lady in front of the stack of paper. Someone dropped an egg on the paper and it's cracked open, and this will represent hypogonadism. The papers are ruined, so the lady's quite angry. She's praying for patience, going amen to represent primary amenorrhea. She got a bit heated over the situation and is fanning herself to help you remember these drugs can be used for hormone replacement therapy. Finally, she's wearing a t-shirt with a baby on it that's crossed out to help you remember their use as contraceptives. For the SERMs, let's look at the recycling bin. Another lady is about to throw away a tambourine, and this represents tamoxifen. Around her waist, she's wearing a giant counterfeit watch that says Ralox for raloxifene. Finally, she's stomping the ground impatiently with her giant boots, going clomp, clomp for clomiphene. For the indications, the tambourine has a picture of a crab wearing a bra to represent breast cancer. The hands on the Ralox are little bones to represent osteoporosis, and there's a bunch of little baby boots scattered around the ground since clomiphene treats infertility. Okay, finally we have the estrogen receptor antagonists like fulvestrant. So we can say the paper shredder is broken since someone dropped a vest in it. It's literally full of vest. There's also a bra with a little crab pinching onto it, since this drug is also used to treat breast cancer. Remember, both tamoxifen and fulvestrant only treat breast cancer that is estrogen receptor positive. Alright, as a quick recap. Synthetic estrogens include ethinyl estradiol, diethylstilbestrol, and mestranol. They are used in the treatment of primary hypogonadism, primary amenorrhea, as hormone replacement therapy, and as contraceptives. Selective estrogen receptor modulators act like estrogen agonists in some tissues and as estrogen antagonists in others. SERMs include tamoxifen, raloxifene, and clomiphene. Tamoxifen is used for ER-positive breast cancer, raloxifene is the medication of choice for osteoporosis, and clomiphene is used to treat infertility. Full antagonists include fulvestrant, which is used for breast cancer that is resistant to tamoxifen. But wait, there's more! Here's a mind map with all the mnemonics. Go ahead and pause the video so you can test yourself to see what you remember. Stay tuned for the answers after the credits. Progestins are a group of synthetic progestogens that have similar effects to those of natural progesterone. They can be divided into two categories, the progesterone derivatives and the testosterone derivatives. They are mainly used as contraceptives, in hormone replacement therapy or HRT, and in the treatment of various gynecologic conditions. Now, antiprogestins act as progesterone antagonists and include mifepristone and ulipristal. Mifepristone is used for medical abortion, while ulipristal is used as an emergency contraceptive. The hypothalamus secretes gonadotropin-releasing hormone, or GnRH, which travels to the nearby pituitary gland and stimulates it to secrete two hormones, follicle-stimulating hormone, or FSH, and luteinizing hormone, or LH. During the 2 weeks following ovulation, which is referred to as the ovarian luteal phase, the remnant of the ovarian follicle becomes the corpus luteum, which is made up of luteinized theca and granulosa cells, meaning that these cells have been exposed to the high luteinizing hormone levels that occur just before ovulation. The luteinized cells secrete more progesterone than estrogen, and progesterone becomes the dominant hormone. Under the influence of progesterone, the uterus enters into the secretory phase of the endometrial cycle. During this time, spiral arteries continue to grow, and the endometrial glands continue to produce more secretions that make the endometrium more receptive to the implantation of a fertilized gamete. After day 15 of the cycle, the optimal window for fertilization begins to close, and the corpus luteum gradually degenerates into the non-functional corpus albicans. The corpus albicans doesn't make hormones, so estrogen and progesterone levels slowly decrease. When progesterone reaches its lowest level, the spiral arteries collapse and the functional layer of the endometrium prepares to shed during menstruation. This shedding marks the beginning of a new menstrual cycle and another opportunity for fertilization. Alright, apart from the female sex organs, progesterone also plays a role in bone strength, as well as keeping the skin elastic. Also, during pregnancy, the placenta takes over progesterone secretion, which is required to maintain the pregnancy, and also helps prepare the breasts for lactation after delivery. But after menopause, the ovaries run out of functional ovarian follicles, so there's no theca or granulosa cells to produce any more hormones, which accounts for many of the symptoms preceding menopause, like hot flashes, night sweats, vaginal atrophy, and osteoporosis. Okay, now progestogens in general are a class of steroid hormones that bind to and activate the progesterone receptor. Once they're inside the cells, they bind to progesterone receptors found in the cytoplasm, and together they form a complex that can travel into the nucleus and bind to progesterone-related genes, modifying the gene expression. Synthetic progestogens, which are also called progestins, are divided into two groups: the progesterone derivatives and the testosterone derivatives. The progesterone derivatives include medroxyprogesterone, hydroxyprogesterone, and megestrol acetate. Now, the testosterone derivatives are basically derivatives of 19-nortestosterone and differ primarily in the degree of androgenic effects. The older testosterone derivatives, like danazol-norgestrel, levonorgestrel, and ethanodiol, are more androgenic than the newer testosterone derivatives such as desogestrel, norgestimate, and etonogestrel. Progestins in general decrease growth and increase vascularization of the endometrium, and also thickens the cervical mucus. While they are able to stabilize the endometrium, they can't support pregnancy effectively like endogenous progesterone does. Okay, let's move on to indications that are common for all progestins. They can be used as contraceptives or birth control, either alone or in combination with an estrogen. They can be administered orally, intramuscularly, through an intrauterine device, or a transdermal implant. They can also be used in combination with estrogen in hormone replacement therapy after menopause in women with an intact uterus to prevent endometrial hyperplasia or endometrial cancer. Even though transitioning into menopause is a natural step in the aging of the female reproductive system, the postmenopausal symptoms may have a negative impact on overall well-being. So in some cases, hormone replacement therapy with estrogens are used to relieve symptoms. But all women with an intact uterus need progesterone in addition to estrogen in order to counteract the proliferative effects of estrogen to the endometrium and prevent endometrial hyperplasia and endometrial cancer. However, women who have undergone hysterectomy should not receive a progestin because its key benefit is prevention of endometrial hyperplasia and carcinoma, and that's no longer relevant. Progestins can also be used in the diagnosis and treatment of various gynecologic conditions, such as secondary amenorrhea, which is when a female who previously had menstrual periods suddenly stopped having them for at least 3 months, dysfunctional or abnormal uterine bleeding, which is when vaginal bleeding occurs outside of the regular menstrual cycle, and endometriosis, which is when cells of the endometrium grow outside the uterus. In amenorrhea, for example, individuals might have intrauterine adhesions or Asherman syndrome. This is when there is scar tissue inside the uterine cavity, typically in a female who has undergone uterine instrumentation in the past, like dilation and curettage. To assess uterine function, a 10-day medroxyprogesterone test is done, which is called a progestin challenge or progesterone withdrawal test. That's where 10 milligrams of medroxyprogesterone is given daily for 10 days to see if that induces menstrual bleeding. A healthy uterus should bleed. If there's no bleeding, then estrogen is given to thicken the uterine lining and medroxyprogesterone is added. Failure to bleed strongly suggests endometrial scarring. Okay, another indication of progestins is endometrial carcinoma or endometrial cancer, which is when malignant or cancer cells arise in the glands of the endometrium. Alright, now for side effects. The toxicity of progestins is low at typical doses. However, they may cause fluid retention and increased blood pressure, fatigue, mood changes and depression, breast discomfort, changes in libido, and menstrual irregularities such as breakthrough bleeding, which refers to any form of vaginal bleeding, usually mid-cycle. Progestins given in high doses for a long period of time can also cause a reversible decrease in bone density and delay the resumption of ovulation after termination of the therapy. Now, older testosterone derivatives like norethisterone are more likely to cause virilization with symptoms like acne, hirsutism, voice deepening, and seborrhea, which is the excessive discharge of sebum from the sebaceous glands. On the other hand, newer testosterone derivatives like desogestrel do not cause these side effects, but they are associated with higher risk of venous thromboembolic disease. So let's switch gears now and move on to antiprogestins, which include medications like mifepristone and ulipristal. Antiprogestins in general act as competitive inhibitors of progestins at progesterone receptors. Mifepristone is given orally in combination with a prostaglandin analog, such as misoprostol or gemiprost, because it can sensitize the uterus to the action of prostaglandins. This combination is used as a medical alternative, called medical abortion, to surgical termination of pregnancy, and it's more than 95% effective during the first 50 days of pregnancy. Side effects include gastrointestinal disturbances like nausea, vomiting, and diarrhea, vaginal bleeding due to the termination of the pregnancy, and rarely, serious infection, sepsis, and even death caused by an atypical infection such as Clostridium sordelii. Now, ulipristal is used for emergency birth control or emergency contraception within 5 days or 120 hours after unprotected sexual intercourse. Side effects include headache, tiredness, and gastrointestinal disturbances. Now let's make a simple and fun mnemonic that'll help you efficiently memorize these pharmacology facts about progestins and antiprogestins. Okay, so let's set the scene at a park. On one side, there is a man and a woman holding hands. They both wear a polo shirt to represent progestins. The woman represents progesterone derivatives, while the man represents testosterone derivatives. For indications, they are talking to a giant condom mascot to help you remember progestins are used as contraceptives. By his feet, there is a large uterus being pinched by a crab, since progestins can both prevent and treat endometrial cancer. The crab is sweating and fanning itself since these drugs also relieve the symptoms of menopause. Finally, behind the mascot, there's a detective investigating a trash can with a bleeding uterus covered in weird lumps. He should help you remember that progestins can help diagnose endometriosis and abnormal uterine bleeding. There's also a box of tampons in the trash with the number 2, so progestins are also used to identify the cause of secondary amenorrhea. For side effects, let's have the man and woman holding hands with a happy little uterus who's bleeding, and it also has shaky, bony legs to represent osteoporosis. Now, these side effects are common in both the progesterone and testosterone derivatives. Okay, next let's give the man a lot of acne, since the older testosterone derivative progestins can cause virilization. His leg is swollen with a bulging purple vein, since the newer testosterone derivative progestins increase the risk of thrombosis. Now let's move on to the other side of the park, which has a big sign that says "No Polo Shirts," and this is where we'll put our antiprogestins. There's a Terminator-like robot here to help you remember these antiprogestins are mainly used to terminate pregnancies. He's covered in patches of blood and bacteria to help you remember the complications like infections and uterine bleeding. Finally, he's also holding his stomach, representing the GI disturbances. Alright, as a quick recap, progestins are a class of medications that include progesterone derivatives and testosterone derivatives. They bind to and activate the progesterone receptor, meaning that they have similar effects to those of natural progesterone. Progestins are primarily used as contraceptives, as hormone replacement therapy, and to prevent and treat endometrial cancer. Antiprogestins like mifepristone and ulipristal compete with progestins at progesterone receptors. Mifepristone combined with a prostaglandin analog is used to terminate pregnancy, while ulipristal is used in emergency contraception. But wait, there's more! Here's a mind map with all of the mnemonics. Go ahead and pause the video so you can test yourself to see what you remember. Stay tuned for the answers after the credits. Uterine stimulants and relaxants, as their names suggest, are medications used to induce or inhibit contractions of the uterus. Uterine stimulants are also called uterotonics because they increase the tone of the muscles of the uterus. They're mainly used to induce or facilitate labor, to reduce postpartum hemorrhage, and to induce abortion. Uterine relaxants are also called tocolytics, where toco refers to childbirth and lytic means to terminate. They're used to stop premature labor in order to give time for the fetal lungs to mature. So the uterus is a super important organ in the female body, because not only does it allow the development of the baby during pregnancy, but it also generates the force necessary to push out that tiny human during labor. This force results from the muscle contractions that take place in the middle layer of the uterus, the myometrium. The regulation of these muscle contractions happens at the cellular level, and it all comes down to the activity of myosin light chain kinase by calcium ions. This enzyme phosphorylates myosin, inducing muscle contraction. On the other hand, this enzyme can be turned off via phosphorylation by protein kinase A, which causes the muscles to relax. Now, during labor, uterine contractions become stronger and more frequent. Normally, this happens at some point when the fetus is considered full term, which means all their organs are functional and it's able to live outside mommy's womb. This typically happens between 37 and 42 weeks gestation. Sometimes, labor doesn't start even though it's been more than 42 weeks. In these cases, it should be induced by the administration of uterine stimulants, which include oxytocin, ergonovine, and prostaglandins. In other situations, the baby, the mother, or both are at risk if the pregnancy continued. These include fetal growth restriction, isoimmunization, premature rupture of the membranes, preeclampsia, or eclampsia. Uterotonics are also indicated to augment labor when the contractions aren't strong enough, and they have the added benefit of preventing postpartum hemorrhage by compressing uterine blood vessels. Finally, they can be used for therapeutic abortion. Okay, let's look at the uterotonics starting with oxytocin. This medication activates GQ protein-coupled receptors, which activates the enzyme phospholipase C, or PLC for short. PLC then cleaves a phospholipid called phosphatidylinositol 4,5-bisphosphate into inositol trisphosphate and diacylglycerol. Inositol trisphosphate is soluble and diffuses freely through the cytoplasm and into the endoplasmic reticulum, where it opens up calcium channels. Since the calcium concentration is higher in the endoplasmic reticulum than in the cytoplasm, calcium flows out of the endoplasmic reticulum to the cytoplasm. Calcium ions then bind to calmodulin and activate myosin light chain kinase, inducing muscle contraction. Now, oxytocin is given via intravenous infusion, and the main indication is for labor induction. In fact, it's the drug of choice for this purpose. But it's also indicated in facilitation of labor and to prevent or treat postpartum hemorrhage. In the last case, by intramuscular injection. But oxytocin not only exerts actions on the uterus, which causes some side effects. On blood vessels, for example, it causes vasodilation, which ultimately leads to hypotension and reflex tachycardia. Also, oxytocin can activate antidiuretic hormone receptors on the collecting ducts of the kidneys, therefore stimulating water retention. For this reason, fluids should be carefully administered. Otherwise, they can cause water intoxication leading to coma or even death. On the other hand, in patients who are suffering preeclampsia or hypertension during pregnancy, and those with cardiac or renal disease, water retention can be an issue, and extra care must be taken. Finally, a situation called uterine hyperstimulation can occur where uterine contractions are too long, lasting 2 minutes or more, or too frequent, with 5 or more in 10 minutes. Uterine hyperstimulation can cause uterine rupture or impaired oxygen delivery to the baby, which are obviously serious complications, so if this happens, oxytocin administration should be discontinued right away. Now moving on to ergonovine. The exact mechanism of action isn't completely understood, but it certainly stimulates uterine contraction. Unlike oxytocin, ergonovine is only used to prevent or treat postpartum hemorrhage because ergonovine can cause prolonged tetany of the myometrium, so it should not be used for induction or facilitation of labor. It can be given by intramuscular or intravenous injection. Besides uterine contraction, ergonovine causes vasoconstriction, which increases blood pressure, so it should be avoided in patients with hypertension. Also, ergonovine can cause vasospasm of the arteries that perfuse the heart and trigger angina. Other side effects include nausea, vomiting, blurred vision, and headache. Okay, so the last type of uterotonic agents are prostaglandins, which include dinoprostone and misoprostol. They exert their actions by stimulating GQ protein-coupled receptors, just like oxytocin. They're also used to facilitate labor and to prevent or treat postpartum hemorrhage. But dinoprostone and misoprostol are also indicated to induce abortion after the administration of mifepristone or methotrexate. They can be administered orally, vaginally, or intracervically. Some side effects include nausea, vomiting, and diarrhea, as well as uterine pain and uterine hyperstimulation. Finally, dinoprostone causes bronchoconstriction, so it's contraindicated in patients with asthma. Let's switch gears and talk about uterine relaxants or tocolytics. Sometimes labor begins too early. If this happens before the 37th week of gestation, the fetal organs, especially the lungs, might not be fully developed. If the baby is born in this condition, they may not be able to breathe or have other serious complications like pulmonary hypertension or intracranial hemorrhage. So in this case, labor can be suppressed with uterine relaxants, thus giving the fetus a few more days in the uterus. During this time, the mother can be given glucocorticoids to stimulate maturation of the fetal lungs. Uterine relaxants include selective beta-2 adrenoreceptor agonists, calcium channel blockers, cyclooxygenase inhibitors, and oxytocin receptor antagonists. And the indication for all of them is the same: prevention or arrest of preterm labor. Let's start with the selective beta-2 adrenergic receptor agonists like terbutaline. As the name suggests, they stimulate beta-2 adrenergic receptor, which is a GS protein-coupled receptor. Protein GS stimulates the enzyme adenylate cyclase. Activated adenylate cyclase takes adenosine triphosphate or ATP and removes two phosphate molecules, transforming it into cyclic adenosine monophosphate or CAMP. CAMP moves throughout the cytoplasm and activates protein kinase A, or pKa for short. pKa then phosphorylates and inactivates myosin light chain kinase, which inhibits uterine contraction. Terbutaline can be administered orally, subcutaneously, or intravenously. Since it's a beta-2 adrenergic receptor agonist, it stimulates the sympathetic system, causing side effects like tachycardia, palpitations, tremor, and nervousness. Next up are the calcium channel blockers. These medications block the influx of calcium ions into the cell so that they won't be able to bind to calmodulin and activate myosin light chain kinase. The final result, then, is inhibition of uterine contractions. The calcium channel blocker indicated as tocolytic is nifedipine, which is one of the drugs of choice for preterm labor, and it can be given perorally or parenterally. Nifedipine also causes vasodilation, which causes some side effects like flushing and dizziness. Moving on to the cyclooxygenase inhibitors like indomethacin, which is one of the medications of choice to prevent preterm labor, just like nifedipine. The mechanism of action of indomethacin is simply to inhibit the synthesis of prostaglandins by inactivating a critical enzyme in charge, cyclooxygenase. So no prostaglandins, no uterine contractions. However, prostaglandins are also important for the baby, since it delays the closure of the ductus arteriosus and promote platelet aggregation. So the main side effects of indomethacin are premature closure of the ductus arteriosus and hemorrhages. Finally, the oxytocin receptor antagonist, atosiban, binds and inhibits oxytocin receptors, blocking the signaling pathway that leads to uterine contractions. However, although several studies have shown that it could be a first-line medication with no major risks, it's not approved by the FDA in the United States. Now we want to make a simple and fun mnemonic that'll help you efficiently memorize and retain all these pharm facts. Let's set the scene in a mattress shop. We can put the uterine relaxants on the show floor where the customers can relax on the mattress samples. In the storage room at the back, we have the employee pushing hard to move the mattresses. And this is where we put the uterine stimulants that cause uterine contraction. So let's start by looking at the uterotonics in this back room. First, we have a minotaur with big feet and big toes for oxytocin. For the main side effects, he worked too hard and fainted, representing hypotension. Someone is pouring water on him to wake him up for water intoxication. To represent uterine hyperstimulation, which is increased contraction, we can compress his chest by putting a 50-kilogram weight on it. Next up, we have ergonovine, which can be represented by an eagle who flew into the back room and got entangled in thorny vines. The thorns tore up the eagle pretty bad, and it's bleeding a lot. This will help you remember that ergonovine is only used to treat postpartum hemorrhage and not induction of labor like the other medications in the back room. For other important side effects, we can put a blood pressure cuff on the wing of the eagle for hypertension and a little knife in its chest for angina. Okay, the last group of drugs in this room are the prostaglandins like dinoprostone and misoprostol. So let's have a stone dinosaur for dinoprostone. He's the manager and he's drinking miso soup for misoprostol. Since these medications also cause uterine hyperstimulation, let's put the dino and his soup on a 50-kilogram weight so he can watch over the entire room. Now, dinoprostone causes bronchoconstriction, so let's give our manager a necktie that's a little too tight. Now let's move on to the show floor, where we have some customers testing out the mattresses, and they will represent the uterine relaxants or tocolytics. So first we have the beta and calcium channel blockers, so let's use 2 knights with shields. One knight has a bee on his shield for beta blockers. He's wearing a turban for terbutaline, which is the main beta blocker used for this purpose. For the calcium channel blocker, let's give the other knight a shield with a bottle of milk on it. His weapon is a large butter knife with cheese dip on it for nifedipine. Okay, for indomethacin, someone left a big lump of dough on a mattress. A rooster is pecking at it to help remind you that this is a cyclooxygenase inhibitor. Also on the bed, there's a duck pecking at a bleeding heart on a broken plate. This will help remind you that indomethacin can cause the premature closure of the ductus arteriosus, and it inhibits platelet aggregation. The final drug is atosiban, an oxytocin receptor antagonist. So let's have a big-footed minotaur laying on the last mattress. Toes are band on this mattress to help you remember atosiban. So let's give this minotaur a pair of gigantic socks. Alright, as a quick recap, uterine stimulants or uterotonics include oxytocin, ergonovine, and prostaglandins, which are medications used to induce contractions of the uterus in order to induce or facilitate labor, to reduce postpartum hemorrhage, or to induce abortion. Uterine relaxants or tocolytics include selective beta-2 adrenoreceptor agonists, calcium channel blockers, cyclooxygenase inhibitors, and oxytocin receptor antagonists, which are medications used to inhibit uterine contractions in order to prevent premature labor. But wait, there's more! Here's a mind map with all of the mnemonics. Go ahead and pause the video so you can test yourself to see what you remember. Stay tuned for the answers after the credits.